Good afternoon. My name is Dr. Jessica Hasson, and I'm a licensed psychologist in Maryland, Washington, D.C., and Virginia. I'm also the Psychological Assessment Director at an insurance-based mental health practice with offices in Rockville and in Frederick, Maryland. Throughout the pandemic, we have been offering in-person psychological assessment services and have conducted over 100 in-person comprehensive psychological, neuropsychological, and psychoeducational evaluations for children, adolescents, and adults without any COVID transmissions. This is due to our use of simple mitigation procedures, including using masks, air purifiers, and hand sanitizer. Our ventilation systems were not updated in response to COVID, nor can we open our windows. Despite not having these additional procedures in place, we feel safe in our office, as do our clients. Our clients are aware of our mitigation procedures and are informed about the specific protocols we follow when someone comes into the office and how we reduce the risk of transmission within the office. It is this knowledge and our transparency with it that improves their comfort with coming for in-person services. You will notice that I'm wearing a mask. It's because I'm at my office at work. Right now, I'm alone in my office. Our administrative staff and another clinician is on site. I could take off my mask, but I don't because I'm a manager in our practice and therefore seen as a leader. The team takes cues from me. If I wear a mask, so do they. If I take my mask off at work, they will see that it's okay for them to do it as well. When you're in a position of leadership, the optics and the presentation matter. This is one area where MCPS, and specifically the Board of Education, has failed. You are discussing bringing students back into the classroom, yet continue to meet virtually. This sends the implicit message that it is not safe to be in person. If it's not safe for you, how can it possibly be safe for students and teachers? In reality, your job does not need to be done in person. This sort of meeting can be done virtually. Still, it sends the wrong message. You're seeing an image of the Indianapolis School District Board of Education meeting that was held in person in December 2020. This sends a message that they believe their mitigation strategies work. At the time of this meeting, their COVID-19 testing positivity rate was over 12%. Ours currently stands at less than 8%. This was an opportunity for you to demonstrate the safety of the mitigation procedures to the education system that you serve, and you failed in that. Another concern is that of transparency. I trust that you have a plan to return to the classroom, but it's not explicit. There needs to be a detailed plan, including making it evident that you will continue to purchase PPE to replace the pieces used, what PPE will be distributed to the classrooms, and how often it will be replenished. A visual of what the spacing will look like in the classroom, the procedures for lunch, and what happens if a student or staff does not comply with masking. We need an explicit plan, and frankly, we should have had it months ago. No more surveys, no more discussion. The return to classroom needs to be a priority. The status quo is not acceptable. Be the leaders that we elected. Because remember, actions speak louder than words, and right now your actions suggest fear, anxiety, and that the status quo is acceptable for the foreseeable future.